How you doing, guys? So this is Dr. Specific Chiropractic. So our guest over here, you've been having, insane vertigo past 2 days, and you even had some serious, bad enough that you had some vomiting, all that stuff. Right? Do you recall anything that set that off in the first place, the vertigo?
It could many things. I don't know. I did many things over the weekend I don't normally do. Mm-hmm. Like I was guest at someone's house, so I slept in a weird pillow. I did my floors, so I was probably doing work I don't normally do, and then I also went swimming, which I normally haven't done in a long time. And I'm sensitive to the floor fumes, so it might have triggered something. And yeah, but I was fine through all of that until the day after.
Okay, all right. Okay, so let's go ahead, let's take a look, see what's going on. Because we're dealing with an active vertigo case, right, and I forgot to mention about this earlier, I'm having the patient sit down as much as possible because that provides a lot more proprioceptive feedback, so to minimize the vertigo itself. Okay, right now she's active vertigo. So now, the bottom line is this: what's going to cause vertigo is contributing to 2 factors. Number 1, there's going to be a structural imbalance, and number 2, there's a neurological issue as well. So when I take a look at the whole entire spine, is anything level? Well, the problem is with this pelvis over here, it's sinking down this way. So it goes without saying, if you're like leaning down this way a little bit, yeah, that's not balanced. It may contribute to the vertigo, all right? Now, other things that's also tilting over, we're also seeing this 4th lumbar vertebrae over here. That's also tilting over. That's not a great position. And the way your body compensated is the 6th dorsal vertebrae had to tilt this way, in opposite reaction to this one going down this way. Now, working our way upwards, we also got the side slip over here. It's rotating, twisting out this way. That tells me if we have a side slip over here, there's too much rotation down here in the pelvis, your body did this way. So your neck has no choice but to kind of rotate opposite direction to try to untwist to going up to here. Now, when the sideways view is over here, we see your neck is supposed to be this direction. Instead, yours did a severe opposite direction. And it's been there for so long, now we have arthritis, DJD over here as well. So whenever I see something this bad on the fifth cervical over here, then I'm looking for an external rotation down in the pelvis, and you got one right here on the right ilium. So therefore, on joint examination, I'm going to confirm my hunch on you. You're going to see this potential PIEX ilium on the right side over here. I'll double check that 4th lumbar over here. See what's going on the 6th dorsal, 2nd dorsal, and that 5th cervical over here. And then all of that should help start re-leveling this atlas over here, because it should be normal parallel to the floor, but no, you're like way over here. And in addition to, you're also rotated this way. So the full combination right now is your head is now it's doing this, that, and this. So suffice to say, yeah, the head not balanced at all. It's gonna have a challenge, and there you go. That's where that active vertigo is coming from. Okay, let's take a look, see what we got. So once again, I'm going to be very brief because this is active vertigo, and to do it without support is causing more instability over here. So very quickly, visualization, a lot of swelling over here, swelling, muscle spasms, tightness to stabilize this unstable structure over here. Same story over here, a lot of swelling, muscle spasms. I'm going to be very gentle, try not to move too much, because again, I don't want to get that vertigo any worse. Okay, so the right hip is not moving at all. 4th lumbar, so
some trouble as well. Found it. How's that? Pain?
Not too
Tender?
bad. A little bit.
A little bit. How's this fella right there?
That's fine. Oh, that's a little tender.
Yeah. Well, like I said, I'm trying to be gentle with you. Try not to cause this thing to flare up. How's this fella right there?
A little tender.
A little tender too, right? Yes, second dorsal.
Yesterday when I pressed on my neck, like it would make the vertigo worse.
Make the vertigo worse. Yeah, kind of figured. Okay, relax the hands. See that? You feel that huge muscle knot right there? Everything's guarding and protecting that 5. Feel that right there? That's not movement. That's a brick wall on that 5. And that fits cervical. Well,
Yep.
coming up slowly. How is that? Just getting upright.
I'm dizzy right now.
Okay, take your time. And when you get your chance, I want you to walk around. Tell me what's different right now.
I feel there's something here, but yeah.
Any difference you notice for your balance and also the dizziness, the vertigo right now?
I don't have dizziness walking, but I did have dizziness like getting up.
Okay. How is the vertigo, everything else right now overall?
It's fine, yeah. I don't feel it now. And I
Compared
don't
to-
feel, yeah, compared to before.
Okay, oh, that's great. So how much improvement would you say right now from back then to now?
Yeah, some improvement. But I can't really, let's see. Yeah, I think I can like swivel my head without feeling like spinning, which is good.
That's good progress.
Yeah.
All right, so to break it out all that down before, because already what you mentioned in history already tells us quite a bit, because you're sleeping in a different bed, okay? Yeah, and you're doing swimming, which was, that's right. What kind of swimming were you doing again? Were you doing freestyle?
Freestyle.
Freestyle. Okay, so basically because you're freestyling, okay, you're basically like twisting the pelvis like this and loading up the whole entire spine. But the problem is your spine is already like this. So every time you swam, you're like basically like twisting that, that torque even more to the point that things just stress, and that's where this thing finally like it snapped and blew the way it did. So let's continue. Let's unravel the rest of your spine.
Okay.
Come on up. How is that getting us just from there?
A little bit better, but I'm still a little, yeah. But a little bit better than the last, getting up this way.
All right. That's good progress. Go ahead, walk around a bit.
No vertigo. No, yeah.
Good. No dizziness, no nothing?
No. I mean, I'm not walking very fast, so, but for the walk I had to do, yeah, that's good.
Hey, that's good progress. Okay, let's start working the rest. Let's set this fella back here. Okay, go ahead, walk around. See about this fella.
That's better. Yeah, it's better.
Better in what way?
Like I don't have as much vertigo. I don't have to like adjust when I get up. I don't have to adjust to the balance, adjust my balance when I'm getting up. So
How much dizziness would you say is left over now?
maybe like a very little bit, like maybe like 10% of it.
10% left. Hey, that's great. Okay, let's get the final part. There's going to be a much more deeper correction. because this is arthritic here. Okay, joint the belly here. So that shows. Coming up when you're ready. And that was strong.
Yeah.
All right, walk around.
Yeah, much better.
Yeah, show the viewers over here. Tell the viewers over here, what's different now?
I think it's much better. Like I don't need to adjust my balance when I get up as much, so I can. It's more my normal way of functioning.
All right, so you said there was like 10% left. How much left over now?
There's probably a tiny bit left, like maybe 5% left.
5%.
Only because I'm not so sure. Like I want to, go so fast, like
Gotcha.
my normal speed. But
Okay.
yeah.
Now go ahead and walk around, see how you like this fellow.
I walk at my normal speed.
Yeah, sure. Oh, look at you, speed demon.
Yeah, I can walk at my normal speed without the adjustment. I mean, without like adjusting my balance.
Yeah, that's
So,
good.
Yeah, that's good.
So you said 5% left. How's it now?
Seems pretty good. Yeah, like what I would normally function at.
Great. Okay. Now, because we got you out of this acute vertigo, and I'm glad we didn't have to use that bag
Right.
just in case.
Throw it back.
Yeah. I know, right? It'd be nice to finally have those airline bags around here. But now I get to actually explain the neurology behind this, because I wanted to get you out of the crisis mode first.
Yeah.
Okay. Now that we actually got you out of this crisis mode, okay, now I can start explaining to you the neurology, why we have to go after your fifth cervical nerve. Now, granted, yeah, you had some structural imbalances here, and there. So we helped address the biomechanical aspect of it, but we also had to address your neurological aspect of it. So now there's a particular nerve, right? And that's what this is over here, okay? Vestibulocochlear nerve, number 8, cranial nerve number 8, right? Now, that particular nerve, right, it deals with hearing, but more important, balance, right? So we need that sensory input, all that data, to go from, from here into this cerebellum right over there. This is our master gyroscope. This fellow over here gets all the information, what's going on from all the senses from your feet, the entire spinal cord itself, where there's a lot of those, the proprioceptors and mechanoreceptors. Okay, in other words, it's telling that spine where everything is in three-dimensional space, but also revealing all this information where everything was unbalanced. And this gyroscope was trying to rebalance your entire spine, but there was a point where it just couldn't adapt anymore. Now, as a result of that, that's where all that information was getting a little haywire and go a little nuts. And part of the structure that deals with that helps stimulate more nerve function in the cerebellum is actually right there at the fifth cervical nerve. So therefore, by restoring this fellow over here, improving the nerve function, allows your gyroscope to start, okay, now we can start recalibrating, see what's going on in the entire spine, we can start doing our job. In addition to that fifth cervical, as you saw in the x-ray, your neck was so backwards like this. By adjusting that, gets you and also rebalance that atlas and your occiput, everything else. A lot of this gyroscope says, okay, now we're not this crazy tilt anymore, now we're in more normal tilt, now we can start rebalancing everything else. And that's how now the cerebellum says, okay, now everyone's happy, the gyroscope's happy, and that's why we don't have this acute vertigo anymore. So the long-term game plan is, yeah, we have to make sure, even though yes, we got your acute crisis mode, but we want to prevent this from going and happening in the future, and that's why in future visits we'll continue working on make sure your biomechanics is in proper alignment over there, and also allow that the vestibulocochlear nerve is also working and operating at its peak optimal function to keep that gyroscope happy. Right? That's what the story is going to be. I want you to continue icing over here in your low back, and we'll see you in the next visit.
Thank you.
Oh, you're very welcome.
So yesterday when I had the very terrible vertigo and I couldn't function, if I pressed on my neck, it would make it a lot worse. And also what made it feel better was putting like a hot compress on my neck.
So basically what's going on is that because since the bone was knocked backwards so much, and you try to put some pressure on that, because you're going to put pressure all the way in, it's basically irritating that nerve. So that's why you felt more nerve dysfunction going to your gyroscope, the cerebellum, and that's why you felt more nauseous, more vertigo.
Yeah.
Okay. But in addition to, by applying that heat, basically what it does is it helps, like, how would I say it? It helps like numb that nerve down a bit. But at the same token, that's why it's still inflamed more, because other purpose, and that's why it's a double-bladed sword. Heat, while it may make you feel temporarily better, but it also increases more blood supply. Therefore, it makes the swelling even worse, and also put more white blood cells in the area to heal up. That's why you should recommend cold packs to reduce the swelling. But if you want to use heat, okay, usually I would use this more of like subacute cases or chronic cases where we do want to make it temporarily more blood supply to the area, so you can bring more white blood cells to the area to help repair the area. And then you put an immediate cold pack, so we can pump all that fluid out of the way. So we can take the pressure off of that nerve and allow your gyroscope to work better. So that's right now, okay, because you're still in, still now we're going to transition to subacute mode. I want you to put just only cold pack, no heat, right? So you can pump and get all that fluid, get that pressure off of that nerve over there.
Got it.
All right?
Okay. Thanks.
Oh, you're welcome.
All right, so give us the latest updates. How's the vertigo and the dizziness come along?
I don't have the vertigo anymore. I do get dizzy just in certain positions, just if my head's bent down or like I'm sleeping on my side or something. But otherwise I'm not, I haven't had the vertigo since the last visit. And I'm able to like walk and function and, walk pretty fast and not lose my balance. And, but yeah, I haven't tried running and I haven't tried anything crazy, but yeah.
Okay, no, that's great. We got you out of the crisis mode. So thanks for the updates on that one. And what we're gonna do is on continuing visits, we're gonna start, stabilizing the biomechanical spine. So that's why that tells me that your spine is still unstable, because every time you look down, it's gonna aggravate it. Okay, so we still got more work to do on that. Okay,
Thanks.
Thank you for the updates. Give us the latest updates. How's the vertigo and dizziness coming along?
It's much better. It's only been a week, but it's like a night and day, and I can function like pretty much normally. I still have a little bit of dizziness if I'm lying down, or like I get up too quickly, but other than that, my balance is great and I can look down and not experience dizziness. And I'm thinking like maybe I can resume like running or something soon. So
very soon. Okay. So just like the viewers who didn't catch that last time. So basically, looking down would still cause problems, but I'm glad that's gone.
Right.
Okay. So now we just got to continue to stabilize the rest of your spine, and we'll get you running very soon there.
Great.
Right. Well, thank you for the updates.
Thanks.